Hello, everyone. My name is Michelle Petri from Johns Hopkins. And for this room now, I've chosen to tell you more about urine proteomics in SLE. This is going to be a big focus on the first day of the meeting, Saturday. Here is the talk that I'm going to concentrate on. It's being given by Andrea Fava in our group, and it's going to prove that change in urinary biomarkers at 3 months into treatment of lupus nephritis can predict the 1-year treatment response. Now, why is this important? You know, right now we base everything on proteinuria. But the nephrologists have taught us that when they do protocol renal biopsies, this doesn't work as well as we need. So on the left, you see that patients who have met a complete renal response, meaning their protein went down, half of them still have activity on a protocol kidney biopsy. And on the right, you can see the same problem happens in the opposite direction. A protocol kidney biopsy can show that the activity has been treated, it's gone, and the patient still has proteinuria, with the proteinuria representing damage. Now, this work was done using the Accelerated Medicines Partnership collaboration. At the same time that a kidney biopsy was done, we did urine biomarkers at baseline. Now, no other kidney biopsy was done, but we could still collect the urine at 3, 6, 9 months. And of course, at 12 months, it was determined whether the patient was a complete responder or not. And usually that meant to mycophenolate. Now, at 3 months, patients who had a downregulation of the collagen-containing extracellular matrix pathway were those that were destined to have a 1-year proteinuric response. Then you can see at 6 months, even more pathways are downregulated in those destined to be responders, and even more so at 12 months. So you see we can get this early look at how the patient is doing at 3 months. And, you know, believe me, we're probably not going to be doing kidney biopsies every 3 months, are we? Now, this is called a volcano plot. Now that we're in this era of omics, we all have to get used to these new ways of presenting data. So what you see circled in blue are all these different proteins in the urine proteome that are downregulated in those that are going to turn out to be responders at 1 year. And what you see in red is the urine protein to creatinine. And you see that all of these markers outperform the urine protein to creatinine. So we can do better. And some of these had already been identified by other investigators. Brad Rovin and colleagues had identified CD163. Our group, for example, had worked on VCAM. So some of these were known, but not the whole group. And that's what omics can give us, the complete picture. So let's take this home. At 3 months, a decline in that extracellular matrix pathway represented by urine protein CD163, CD206 can predict the 1-year response, and this outperforms proteinuria. These are going to allow early treatment changes once we get them into routine clinical practice. And can you imagine maybe someday these will be the outcomes in kidney trials, so we don't have to do 2-year trials, we'll do 3-month trials. Now, of course, we need more longitudinal studies, don't we? Because these are based on a relatively small number of patients that were in the AMP study. I want to thank you for listening. At the ACR meeting, please go to room now. We know where everything is happening. Thank you.